So there is a lot of confusion between hospice and palliative care. Oftentimes people think of them as the same thing, and they really are not. So hospice care basically is care given at the end of your life, meaning 6 months or less to go, if that's what the physician thinks your prognosis is. Within that, you get a defined benefit as paid by most insurance companies, which includes a nurse, manager, sometimes a home health aide, a chaplain, a social worker, provide that good care to keep you at home as long as possible. You can have hospice care in various environments, but most of our patients remain at home. Where palliative care, you get a full team of providers, but you do not need a terminal diagnosis. So you can have any disease process at any stage of illness. So palliative care is specialized medical practice that helps to support families with life-threatening and serious illness. It's a team of providers, including a physician, nurse practitioner, RN case manager, social worker, that focuses on the patient to make sure that we meet their goals of care. You can have actually palliative care early in your course of disease. I think what's important with palliative care is that the earlier we get involved with life-threatening and serious illnesses, the better the patients do. They actually live longer, they live better.
When you hear hospice, let's face it, it's the end. But when you hear Samaritan palliative care, it's not the end. It's the beginning of something different. It's something that you may not want to do. It's probably the hardest thing you're ever going to do in your life, but it's worth it. And the people here at Samaritan will help you. They are not going to walk away. They just won't walk away. It's not in their DNA to do that. There is no better resource that I can see for a person that has a significant illness or is coming towards the end of life than the compassion and the honesty and the different networking they can do.
We come to your house and we get to evaluate you and your family and see what your environment is actually like, which can provide a very good insight to how we can care for you. We'd like you to call Samaritan to help determine which level of care is important for you. Samaritan is very proud of the ability to evaluate you and help you determine what level of care is appropriate for you and for your family.